It's a pet's life with Gym Dog, Ireland's first pet resort by Des the Vet. Managed by vets, loved by pets. Daycare, vet care, premium pet food and grooming. Visit at petslife.ie.
Yep, and it's a Tuesday morning, and a very good Tuesday morning to our resident expert. He loves being called that, don't you?
Morning, John. Great to be here again.
Yeah, how are you today?
I don't know about expert now, but I do my best.
Well, there's somebody in the business long enough as well. I love the way that every time we talk about different topics, we're going into the 21st century and we're going really into new ideas and new ways of thinking. I was mentioning before the break holistic medicines, and people are probably laughing at the radios listening to holistic medicines when it comes to animals. If it works for humans, it'll work for animals.
Yes, some things that work for humans work for animals also. Holistic medicine is just a term meaning that we look at the whole body and we look at the full picture around a pet's lifestyle and nutrition in conjunction with healing whatever ails.
Okay, and that's it in simple terms. What about the origins of veterinary in general?
The origins of veterinary are interesting. Believe it or not, the ancient Egyptians, the 3rd millennium BC, there was an Egyptian veterinary healer attached to the royal house of the pharaohs of Egypt, and his name was Ur-Lagadep.
Okay.
There you go. He was the first vet, allegedly, thousands of years ago. Now, of course, in those days, the treatments would have been very rudimentary and largely dealing with, I would say, beasts of burden, being able to keep the horses moving. That sort of stuff.
Okay, yeah.
Now, we say there is evidence of it in ancient Egypt. More recently, in the times of the Roman Empire, a millennium or so later, right, the word veterinary was coined. Because the root word of veterinary, veterinaria, refers to the cart horses and the chariot horses, which indicates that the origin of the first vets would have been for the military and for transport and keeping the chariot horses moving and keeping them sound. Yeah. So that's how it all started. So veterinary. The use of veterinary skills and veterinary medicines very much tied into agriculture and tied into the using animals for work.
And what about modern times? Are we talking about the 19th, 20th century when it became more popular as in mainstream?
Yes, mainstream. So the 1860s or 1880s, I believe, the veterinary college in Ireland was founded. So that's when proper veterinary medicine started in Ireland. The very first veterinary school was in France around 1670. Now, there are very big differences between human medicine and veterinary medicine, primarily because our patients don't speak.
Yes. Okay,
so we regard ourselves largely as a conduit or an interpreter in many ways between the owner and the animal. It's a tripart. There's 3 parts to the relationship. There's the owner, there's the patient, and then there's the vet.
So basically you have to come to the conclusion and the general basic diagnosis based on examination, touch, feel.
Yes.
Before you get into the nitty-gritty of bloods and before you get into the nitty-gritty of x-rays. But I'm talking about the basic examination.
Yes.
And I know where you're coming from. I mean, yes, something as simple as a stomach bug in a cat or a dog, you know by maybe... If you're holding the stomach of a cat or a dog and it's all kind of tense and whatever else, you know then there's something going on.
Yes, so there's a checklist of clinical signs, and we don't call them symptoms, we call them clinical signs, because symptoms are something that you tell your doctor.
Right, didn't know that either. Go on. Yeah, so good one.
A clinical sign is something that we have to ascertain by an examination based on using our 5 senses.
Okay, so you're in veterinary college and these are the basic things that you're told. This is what you're taught to do.
Yes, this is how you're taught.
To use your brain
signs.
And in anticipation.
Yes.
What's the rate like? I mean, what percentage are you getting it right?
Well, to be honest, I think if we get to 99% in our business, we're doing well. Because, as they say, our patients don't speak, we're often limited by financial constraints in that veterinary is totally in the private sector.
Yeah.
You go into your doctors, you go to hospital. There's a huge public sector, public service element to human medicine. So tests that cost big money to get set up for and to have the facilities for, right, on a human level, they're laid on by the HSE, aren't they?
Yeah.
Whereas on a veterinary level, no, it's all catered for by the private sector, by small businesses like mine.
The one thing that I, from doing this slot for 10 or 15 years now on the radio, the one thing I noticed that from from the talking to individual veterinary surgeons, veterinary guides, vets like yourself, is one, that you, from an early age, you love animals. Two, there's usually a connection in the background that you're part of a farming or part of an animal community of some sort, generally. I'm not talking about going into the heart of maybe Dublin or wherever else. And the general feel for many of the guys that I've dealt with over the years, that's the love, the initial love, and they want to kind of help and prevent pain and kind of hardship for animals. Is that a fair way? Is that if I'm talking to guys that when you went to college and other vets, how do they usually get into this?
So there's a vocational element, which is an interest in animal welfare, an interest in in healing animal pain, an interest in interpreting animals' needs and instincts for the owners. So to be an advocate for the animal, that's a big part of the vocation.
Okay, right. So now let's take it to the next step, which is our topic of the day: holistic. So is it a case that some guys, like a bit like in the human sector, is holistic is away with the birdies?
Yeah,
no pun intended. And when it comes to the veterinary, it's the same thing.
Yeah. Well, you see, it's an inexact science.
Right.
So we do have to cling on to facts and figures and results. And we have to cling to hard results, which are derived by scientific analysis, by a scientific process.
Yeah.
That could be a process of using your checklist and doing your clinical examination, followed by a series of tests. So all we have in terms of examining animals, we have to take the guesswork out of it, we have to apply facts.
Yeah.
So that is why we use scientific principles, because outside of the realms of science is guesswork.
Okay, so when it comes to when we say holistic medicines and holistic way of treating domestic animals, is it all kind of herbal medicines and stuff like that?
Well, you see, there's no conflict between alternative medicines, holistic medicines and conventional.
Okay.
In my view, there's no conflict. Now, in some people's minds, there is a conflict. It's either or, and one competes with the other. There are vets who are against certain types of alternative medicine because they're too wishy-washy, they're too uncertain. And I would be of that school of thought that there are some types of alternative medicine that are too wishy-washy to be hanging your hat on. They're too wishy-washy to depend on, to rely on. But in conjunction with good conventional medicines, lots of alternative remedies and natural remedies can be a big help in helping to heal the animal and in helping to improve the health and the overall picture of the health.
Okay. Quote I have here: homeopathy, as we go in that direction for a second, is based on the idea that like cures like. When a large dose of toxic substance is swallowed from an animal, it can produce death. But when a homeopathic diluted minute dose of substance is given, it can promote a cure. Remedies are made from plants, minerals, drug viruses, bacteria or animal substances dissolved in water, alcohol, diluted and vigorously shaken can actually work.
Okay, you see, that principle of dilution is exactly the opposite of the principles of conventional medical therapy that I would have learnt in vet college. Okay. So that's completely going in the opposite direction.
Right.
I can't say whether it's right or wrong, but there isn't conventional science to it.
Okay, and it also says here for herbal medicine, right? Herbal medicine, the use of herbs and plants for medical purposes has been practiced for millennia all over the world. And veterinary herbal medicine includes Western herbs, are very popular.
Yeah, that's very true. Now, the whole thing about herbal remedies and natural remedies, it's important to remember that all medicine comes from nature, ultimately.
Yeah.
All medicines originated as herbal remedies. So there's no conflict between using herbs or natural medications and conventional medicines together.
Okay, fair enough. So when we're talking about holistic, are you going to a holistic vet or are you going to somebody like yourself?
Well, a lot of good, would say normal practitioners, general practitioner practice vets have an interest in acupuncture, have an interest in alternative remedies, have an interest in physiotherapy and lasering and all of these things that are considered a bit alternative, because we're aware of the fact that big difference between my patient and the human patient, you see, is that I will never be able to derive 100% full picture analysis on an animal because I don't have the same diagnostic tools at my disposal as the big human hospitals have.
Yeah.
So it is a far better approach for me to adopt a holistic attitude, in that I'll use conventional medicines and then I'll probably recommend an alternative remedy and a natural medicine along with it.
Okay, Sarah was on. She says when she was in London about 2 years ago, back where she lived, her cat, Elliot, relaxed totally during acupuncture treatment as a result of arthritis.
Yeah, that's true. I have a few friends in the profession, veterinary colleagues of mine, who do acupuncture and are good at it and swear by it. And there's no conflict between, if you have a dog or a cat or any type of an animal, a horse, a racehorse, there's a lot of it used in sports medicine for racehorses and greyhounds, for instance.
Yeah.
And you may have an animal like a racehorse or like a racing dog or a working dog recovering from an injury, and that dog could be on a course of injections from the vet and a course of medications from the vet, and you could definitely also use acupuncture and physiotherapy at the same time. It just depends how committed, how invested you, the owner, want to be.
Okay, a standalone question here. Is there such thing as an holistic vet where they only do this?
In Ireland, I can't say that I know a vet. If you're asking, are there any vets that kind of reject conventional medicine and only go down the Chinese route or whatever, I would say no.
Yeah, I would say that most guys wanted to enhance it alongside the mainstream.
As I say, there's no conflict. It's an enhancement of the mainstream.
Okay, and so let's put it into simple context. An holistic vet that we're talking about and a mainstream vet. What are the 2 or 3 main differences?
Well, the difference is that a vet that considers himself holistic would be recommending pharmaceutical products and nutraceutical ones at the same time.
Okay.
Would be looking at the diet, the overall diet, at the same time during the healing phase of an animal, and would be prepared to look at hydrotherapy, physiotherapy, acupuncture, and so on, in conjunction with the conventional medicines. So there's a word there I use, John, nutraceutical. That's a nice trendy term that you'll see a lot now in chemist shops and in vet clinics. A nutraceutical is a natural product that's considered to have pharmaceutical or healing properties.
Okay, so I just did a quick googly bit there, right? So already there's a couple of places that are coming up that are 100%. Portmarnock Veterinary Clinic and the Holistic CVC Dublin, Holistic Vet Dublin, who are practicing it and are just saying that how it's grown, blah, 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 blah. So obviously the fact that there is now practices beginning to go that direction, obviously they're still mainstream, and we're not saying they're not, but they're taking the chance to improve the welfare of the animal.
That's a bit like, as we've said every week, about the benefits of good nutrition and how it can enhance health, enhance wellness, prevent disease, as well as helping recovery from disease. So using good holistic principles means applying good natural products that are nutritional as well as healing at the same time, along with your conventional medicines.
Yeah.
So, for instance, penicillin.
Obviously, absolutely.
That started as a mould.
That's right,
It would have been used by natural healers for thousands of years.
Yeah.
Aspirin.
Yeah.
That started as the bark from the willow tree.
Didn't know that one.
These are considered natural salicylates, the aspirin family. There are natural salicylates in aloe vera.
Yeah.
So the reason aloe vera works and is prized by so many people and is so effective in whether you ingest it or whether you apply it to a wound or whatever, it has natural aspirins in it.
Yeah.
Natural salicylates. There are other foods and common vegetables and so on and herbs that have natural antibiotics in them, like garlic, cumin, curcumin, turmeric. These have natural antibiotics. Honey has a natural anti-inflammatory in it. So they can all be used along with the other anti-inflammatories at the same time.
Yeah, I could say cats and dogs would love honey if you're given a little bit of honey, wouldn't they?
Yeah, Manuka honey has great healing powers.
Yeah.
So Manuka honey is a particular type comes from a particular type of honeybee.
Yeah.
Was first developed in New Zealand. It's widely available now, and it has natural anti-inflammatories in it.
Yeah, that doesn't necessarily mean you take a spoon of honey and chuck it into the bowl of a dog or a cat.
No, but you apply it to the wound or whatever.
Yeah. They end up licking it off anyway.
Yeah, that's it. They will lick it off, of course.
Yeah, of course they will, absolutely.
Yeah.
And Mary was on. She said that she brought her Cocker Spaniel to the vet about 3 weeks ago back. The vet said there was something like a small infection in his ear, gave him some drops, etc., blah, blah, blah. And subsequently, the diagnosis came back as dermatitis.
Yeah, that'll be right.
Okay.
There's no conflict there. So a lot of ear infections the ear is part of the skin.
Yeah.
So when you have inflammation or infection at the extremities, by the extremities I mean ears, toes, tail.
Yeah.
They're the extremities. Eczema occurs in those locations. Dermatitis occurs in those locations. So certain types of eczema and allergies occur in the ear and the paws.
Yeah.
Either or.
Okay, and obviously because the way animals kind of clean themselves with their tongue, they're probably passing it around from one part to the other part, are they?
They do.
Yeah.
They do. So that dog there, Cocker Spaniel with an ear infection.
Sounds about right with the lovely ears, the fluffy ears.
They suffer with ear problems. Cocker Spaniel owners always like to talk to them about ear care from the word go to try and prevent these things from happening.
And what type of prevention would you do for ears?
You have to keep them clean.
Yeah.
You have to dry them after a wash or after a bath. Never leave the inside of a dog's ear, particularly a floppy-eared dog. Never leave the inside of the ears wet.
And I saw something online before where it said that if you can get a hairdryer, put it on a very cool setting or and you can put it on a low setting, it will dry out the ears.
Yes, it will. That's very good.
Yeah.
And of course, this is what groomers do.
Yeah.
And it's what's done all the time.
And to be honest with you, when groomers are in action, the dogs just sit there and they love it being pampered.
They get used to it.
After
they
5
enjoy
minutes, they realise they're being pampered.
Yeah, that's it. They're in the right hands of somebody who's able to give the right signals and calm them down and give them reassurance. They'll sit quietly. But always dry the ears. Look at the diet as well. That dog there with the eczema, probably the ear infection, which is linked to a dermatitis. To me, that reminds me of an allergic condition. Usually a dog with that problem, I'm suspicious there's an allergy somewhere, and I would be having a conversation about what the dog might be allergic to.
Okay, Susan's on. She says she's a black Labrador, 3 years of age. Cut himself about a month ago back. The wound hasn't really healed that much after a month. It's kind of on the knuckle bit and the bendy bit of the paw.
So it's not healing because it's on a point of motion.
Right, okay.
She says on the bendy part of the paw, yeah. So that's cracking open every time he moves.
Right. So
I'd say at this stage, look, you'll end up with a nasty scar if there isn't a bit of intervention soon. So I would let a vet, your local vet.
What will they do? Wrap him in something to stop it? Or?
It might need to be bandaged to reduce motion, reduce the amount of movement for a while to allow it to heal.
Yeah, good one.
And use particular creams.
Okay, hold on, there's another question coming in here. This is... Okay, so I was on to you last week about my 12-year-old boxer. Went to Des last Friday. Top-class vet. Are you talking about Des Groom now or some other Des?
Somebody else, yeah.
Coda is doing really well, says Noel.
Okay, that's great. Yeah, Coda's a lovely boxer that came to us, and we did do some x-rays, and we did get to the root of the problem. So glad to hear that the medication's working.
Okay, 12-year-old boxer, is that good?
That's a good age. Boxers wouldn't have the greatest longevity. So 12 is quite a senior age for a boxer. But they come to us in good shape and we can put a few interventions in place. Then a dog like that will have years left.
Okay, I like boxers for some unknown reason. I just remembered in the 80s and 90s there seemed to be an awful lot more of them, of just an ordinary boxer.
Yeah,
now
there's
variations
different colours of them and all the rest of it.
Yeah.
Kind, lovely dogs.
Yeah, they are, absolutely. Right, that's it. We're done and dusted for today. That was a quick 20 minutes.
Great, John.
And, of course, if you want to get in touch with Des, you can drop down to him. Where's the best way? Just check the website, is it?
Petslife.ie.
Petslife.ie, that's simple. There you go. I was talking about a cheap plug.
Thanks, John.
Yeah, there you go. No, I didn't mean it in the negative. I meant it in you didn't sell yourself too much. But anyway, you want to get in touch with the guys just through the website. It's a Pet's Life, and they'll give you more details on that. And we'll have another interesting topic. That was really cool, and it's nice to find various different topics that we can have a chat about your various different animals. And thanks for those questions again. We'll do it all again next week here on KFM.
It's a Pet's Life with Jim Dog, Ireland's first pet resort by Des the Vet, managed by vets, loved by pets. Daycare, vet care, premium pet food and grooming. Visit a petslife.ie.